Hi, Brother Wilson. For my lesson, I will be teaching Mariah basic vital assessments of pulse and respiration. I decided on this lesson because she expressed an interest in learning about how the body works. To start the lesson, I'll ask her how do both the pulse rate and respirations help us assess how the body is doing. This will first help her to analyze the information. Also, it will help her to, will help me to gauge her zone of proximal development as well. This question will also help me to pre-assess anything she already knows and help me to adapt my lesson plan as we go along. We'll then elaborate and discuss how vital signs may be different between healthy patients and sick patients. I hope to have her gain some sort of situational interest by assessing her own pulse first and also listening to her own respirations with a stethoscope. We'll then move on to check any misconceptions she may have on checking pulses and respirations as well. There are a few different ways to check for pulse, especially in adults and infants. I want to see and check if she has any misconceptions from the past on checking these vitals. I'll go over the different types of places or different areas you can take the pulse, like the carotid artery and also the brachial artery, and teach her different schemas for how to remember these types of arteries, as well as the dorsal and tibial arteries as well. I'll help her to create memory patterns to um, keep them in store in her memory. Along with the different ways of taking pulses, I also want her to understand that there are right ways and wrong ways to do it, that you may get an incorrect pulse rate if you do it the wrong way, which we'll review positive instances and negative instances as well. Then I'll go over taking vital signs for 60-second increments, 30-second increments, and also 15-second increments. This will kind of go in or tap into her mathematical logic and structures, and tap into Piaget's stages, as well as assessing psychomotor domain. I'll also pose a question on whether or not it's a good thing to round numbers or make up numbers when assessing vitals. This will assess her moral development as well. And during the lesson, we'll pull in some people that she is not familiar with to assess their vitals, which will help her go over intimacy and isolation, and trust and mistrust. I'll have her assess my daughter and take her vitals and respirations. My daughter is 3 years old and will pose a challenge to her taking vitals, so that will make her become creative while following through with the lesson. And to be sure that the lesson leaves with her outside the classroom, I want to give her an assignment in which I'll follow up with her, where she will be taking the assessments or vital signs of 3 other people. They can be in her family or friends, and I'll let her decide that.